Okay, good afternoon, welcome back. Our next panel is going to be on risk modeling and triggers for payout. This was a discussion which had already started in the morning when we saw Martin and Nathan and others start to talk about, can we quantify the risk, to what extent can we define triggers, and so on. So we hope with this panel we can continue that conversation. We have 4 panelists. We have Nathan Wolfe, who you've heard from earlier. He is the CEO of a company called Metabiota and is on the faculty at Stanford University. We have Martin Meltzer. He leads the Health Economics and Modeling Unit at the Centers for Disease Control of the US. We have Gordon Wu, who you heard from this morning. He's a catastrophist at Risk Management Solutions. And we have Neeta Madhav, who is a principal scientist for research and modeling at AIR Worldwide. So that's our panel. Like the format of the earlier panel sessions, I'm going to pose 2 questions to each of the panelists and give them the same time 7 minutes. The intent of this session is to understand what do we know about quantifying the risk from pandemics, what kind of models exist, are we thinking about pandemics in a single generic sense, or are there differences between them? And then also, how can we define triggers for payouts? If there are risk products which require a trigger, what would those triggers look like, and how should they be structured? Who should be the governing agency for that? So that's the sort of discussion we want to have in this. I will start with Nathan. His company works with ARC on modeling pandemic risk and how it incorporates into the financing models. So, but before we get into that, we want to ask Nathan, in your work, you say that not all pathogens are same, not all risks are same, and it's probably not appropriate to just talk about a pandemic. There are differences, and therefore we can categorize pathogen risks into different categories. So can you tell us a little bit more about that, Nathan?
Yes, all risks are not created equal. And I will give probably a little bit of a different flavor, I think, than some of the other panelists, so thanks for calling on me first. I'm a virologist by training and a research scientist by training. I've spent most of my career trying to understand the nature of epidemic diseases and to really find ways to monitor and model them. Over the last 2 or 3 years, I've been really fortunate to be able to, in addition to supporting government, be able to support organizations like ARC, some of the reinsurance organizations, thinking about epidemic risk transfer. And I must say that I am incredibly excited about this topic. It's sort of an interesting topic to get incredibly excited about. But I do believe in sort of 20 years of thinking about epidemic risk, that some of these financing solutions might really just be one of the crystallization points to change the way that we think about them. And I'll walk you through that a little bit. The 3 points I'll make are really, number one, epidemic risks are massive and we underestimate them. Number 2, they're not monolithic, and I think we sort of group them together to our peril. They're everywhere. They touch every sector, whether it's corporate or sovereign or individual. That frankly, there's a big, likely a big private sector market for epidemic risk. And finally, that despite that I've spent most of my life working with the public sector, I think that that's a really good thing. So first, to the point of massive risk. We know much more about the nature of epidemic risk now than we have at any point in history, and certainly there's been an acceleration in our understanding of the nature of epidemics over the last 20 years. It's easy to forget, but the fundamental nature of human integration has fundamentally changed over the last couple hundred years. And what that means is that while the vast diversity of viruses present in wild animal reservoirs have constantly pinged into human populations, the lack of connectivity meant that those were by and large localized events. And even the change in transportation and networking and mobility over the last 20 or 30 years has been profound. The diversity of agents that we have out there, and also our interface with animal populations, has increased. We sort of have a very recent view of these kinds of events. We do see some trends towards increasing frequency, but we also have a sense that history gives us some guide to what we're likely to see. And I think that we can get a sense of what we're likely to see, but this goes to the second point, namely that these risks are not monolithic. And I think this is a very important point, and it'll be straightforward to everybody here, but there is a tendency among the public to think about what some of us call the disease du jour, right? And if it's after influenza, then it's really a focus on respiratory viruses. And if it's Ebola, it's a focus on viruses of that sort. And what's very important, I think, for us is that we take a step back and we see these different agents in the vastly different ways that they are. One of the great examples from my perspective is HIV. HIV is a disease that most of us have forgotten in the pandemic community. It's now considered to be a chronic disease. It's definitely a part of our development activities, but HIV is an emerging infectious disease in the same way that Ebola is, in the same way that H1N1 is, H5N1. This was an animal virus that crossed into humans. The connectivity between human populations led to its massive spread across the planet. And I think it really points out, and one of the things I'm quite interested in from colleagues here on this panel is the nature in which epidemics do fit into sort of a NatCat kind of perspective and the extent to which they really are distinct. I mean, from my perspective, HIV is the hurricane that's still blowing, 40 years after it started. And, obviously there are the other obvious features in the sense that we can change the course of epidemics as they happen. And I think that the nature of the health systems that underlie the way that we prepare for, respond, and address epidemics is a little bit different than the nature of some of these other NatCat risks. Third point, these are everywhere. And again, I think that we easily are lulled. I was an academic for most of my career, worked a lot with government, so we're lulled into thinking of these as public sector issues and public sector problems. But the massive nature and cost of this sort of risk touches everybody, right? It's not just mortality, it's not just dailies, it's social impact, it's economic impact. We've seen that very clearly in the case of Ebola. And it touches on just about every corporate structure in the world, and it touches just about every human population. Every human individual is holding some level of risk. And certainly what we've seen in other areas of natural catastrophe and other areas of risk is that there's always a desire and a capacity and a market for appropriately transferring this risk from individuals that are holding it to individuals that are willing to take it, and that transfer creates a certain resilience. And what it means is that you have a pension, you have a life insurance policy, and if an epidemic hits, these kinds of things have the potential to equilibrate the system. But all of these things has to happen before an epidemic strikes. Once the thing has hit, it's going to be too late. From my perspective, this actually means that there's a big market for epidemics. And this is something that we haven't seen, and many of us kind of instinctively may have a bit of a knee-jerk response to that and questioning whether that's a good thing or bad thing. I think in the second question, I'm going to tell you a little bit more in detail why I think that, in fact, is in fact a very good thing. And I don't know where I am with time, but maybe I see yellow light, so maybe I'll leave it at that for the first question.
Yeah, thanks. So we hear you are doing some risk modeling work for the ARC so that they can start getting into pandemic financing models. Could you tell us more about what is the nature of that modeling and how it feeds into pandemic risk financing?
Sure, happy to. And yeah, we've been very fortunate to be able to have some dialogue with President Kim as he was thinking about these policies, and to work with ARC and a number of agencies, and really, whether it's U.S. government or the private sector, trying to understand the fundamental nature of these epidemic risks. And ultimately, there's a lot of different outcomes. I'll just tell you a few things that I've concluded. Number one, I think that it's clear, and some have said this before, but I'll continue to make the argument that, in fact, these are clearly insurable risks, and that our capacity to insure them will only grow over time, right? Cat's already out of the bag. I don't think this is going away. This is already something which has started. I think that, again, as I stated earlier, I think that's a really good and important thing, and I'll tell you partially why, and I'll come back to ARC in a moment. And that's because I believe that capital is part of the equation. I think it was Richard asked a question sort of about the iterative nature of should you come up with the financing mechanism first and then sort of go back to the people who are doing preparedness and surveillance, or vice versa. And the reality is that this is an iterative process, and frankly, capital has been absent from the process. I'm going to make a little bit more of a point on each of those. I won't spend too much time arguing that it's insurable, because somehow I think we're going to get to that in our discussion. Instead, I'll tell you a little bit about some of the ARC work and why I find it to be interesting, and then to sort of generalize that. And again, from my perspective, these mechanisms are going to be, the nature of the risk, from my perspective, is so large, and the number of individuals that are holding risk is so numerous, that the notion that there would be one particular approach to how we would insure or transfer this kind of risk seems to me to be completely absurd. And there is a little bit of we should let 1,000 flowers bloom from my perspective. We should be encouraging a broad diversity of mechanisms to permit risk exchange that are appropriate, and see which ones succeed in which particular different way. And I do think it's going to be very critical as we go through the parametric triggers that they're going to be associated with the objective of the risk transfer. There's not going to be also some sort of really monolithic set of risk parametric triggers that we have for all of these different elements of risk transfer. With regards to ARC, I think part of this is just what they and their partners and the rest of the African Union have shown with regards to drought. And this goes to the point of creating a fundamental ecosystem, right? And to get there, I'll tell you about my history. So we don't really think of surveillance and response as these things that are siloed. In fact, they really, preparedness, surveillance, and response are sort of very much integrated. For example, if you have limited surveillance activities, you have to increase your response. If you change your preparedness by knowing exactly what kind of outbreak and surveillance you have. So these things don't exist in a vacuum. And ideally, sometimes they do, but they shouldn't. These are things that need to sort of be dynamic and play off each other. What they have existed in a vacuum from historically has largely been sources of capital, right? And you had to plan your surveillance and you had to plan your response without knowing the pattern by which you would see capital, and without having capital be an integrated process into the development of surveillance networks. And again, I think all of these mechanisms do a very sort of similar thing. And just to walk you through sort of how I see the ARC mechanism, part of what it's doing is it's engaging with country partners, it's developing contingency plans, it's basically understanding the specific nature of the risk. And so what actually happens is you have countries who are going to be invested into a particular program as a country. What that does is it creates interagency connections, right? So it's not just the Ministry of Health or the Ministry of Livestock. You also have the Ministry of Finance involved. What that also means is that there is a sense for these countries in which they can anticipate the way in which they're likely to be able to see capital in a very specific way, and that the way that they do outbreak planning and the way that they integrate outbreak response planning with surveillance can be based on a knowledge of how capital will appear. And I think that lack of capital understanding of the speed and nature of capital that would be associated with it has very much limited the quality of preparedness and surveillance that countries are able to enact. And maybe just the final note I will say is, and again, I think I'm echoing folks that have spoken earlier, which is we should just get started. Right? These are things that are going to improve. The nature of the triggers, our surveillance systems are rapidly improving. We got, I think, a really nice brief from Jordan earlier about the nature of the global health security agenda. These systems are not perfect, whether it's IHR, whether it's GHSA. Having said that, the world has moved forward substantially in terms of our scientific understanding of these events and the quality of surveillance systems that we have. And there's a lot of investment moving in that way. And organizations like, for example, CDC, that have been stymied in their capacity to do what's at their basic mission, that now we're going to get to see what happens as that rolls itself out. So the notion that we should be somehow inhibited from investigating these sorts of innovative mechanisms because they might not be ideal to start with, for me, belies the evolution of the ecosystem which will emerge between these different pieces as they get started. So I don't think any of these mechanisms are going to be good or ideal, but when they work together, I think that there's going to be tremendous capacity for them to be sustainable and for them to really increase our understanding of the nature of risk and mitigate the way in which the efficacy by which we respond to that as well.
So is it fair, is my understanding fair that in typical risk modeling, capital was considered to be exogenous and you would do risk modeling, and now you're saying that is an endogenous variable that is very much within the model? Is that a good characterization of that? Or?
Yes, I'm saying that, but the additional thing that I'm saying is that, part of what my hope was is to kind of link this discussion to also the broader preparedness and surveillance. And that's been this question of how is the financing going to be linked with the sort of day-to-day surveillance that goes on in these countries. And I think that if you're working in a country, I'll just take Cameroon, for example. I lived there for half a dozen years. It's a country that in many ways is more advanced, well, maybe not in many ways, but in some ways is well advanced from the United States in the fact that they have an interagency pandemic prevention program that, modeled on HIV programs, touches each ministry, has their part in pandemic exercises they do in a coordinated way. Well, when surveillance occurs, it is siloed between livestock and human and crop, and that's unfortunate. Programs like USAID, EPT, they're changing some of those features, but still, certainly development of surveillance and outbreak, while they work together, they are not sort of deeply tied to contingent financing, right? And pulling them together, knowing exactly the nature of the financing you're going to have, having your contingency linked to that particular financing, and letting your surveillance be a part of that ecosystem means that you can create that system in an adaptive way that anticipates the resources you're going to have.
Thank you.